1.4 billion people today live with hypertension in 2024. Yet, just over 1 in 5 have it under control. Every hour, over 1,000 lives are lost due to strokes and heart attacks from high blood pressure, and most of these deaths are preventable. So in other words, uncontrolled high blood pressure claim more than 10 million lives every year, despite being preventable and treatable.
Thank you very much. Well, there you have it. Dr. David Ede-Edokpolor, consultant obstetrician and gynecologist on mother and child for today.
1.4 billion people today live with hypertension in 2024. Yet, just over 1 in 5 have it under control, either through medication or addressing modifiable risk factors. Hypertension is a leading cause of heart attack, stroke, chronic kidney disease, and dementia. So it is both preventable and treatable, but without urgent action, millions of people will continue to die prematurely, and countries will face mounting economic losses. Why is this so? From 2011 to 2025, cardiovascular diseases, including hypertension, are projected to cost low and middle income countries approximately $3.7 trillion, equivalent to around 2% of their combined GDP. Now, it concluded that every hour, and this is very important, every hour, over 1,000 lives are lost due to strokes and heart attacks from high blood pressure, and most of these deaths are preventable. So in other words, uncontrolled high blood pressure claim more than 10 million lives every year, despite being preventable and treatable. Which is why we must commend your Mainland 98.3 FM station for bringing this topic out to the public domain about the issue of cholesterol. So that is just a brief overview of the impact of cholesterol, because I will not talk about how cholesterol leads to that later.
Alright, now let's actually talk about it now, because you're talking about, the mortality rate. So what role exactly does cholesterol play in this cardiovascular diseases that happens to be one of the leading causes of death across the world?
Yeah, thank you very much for this beautiful question once again. Now, what is cholesterol? Now, cholesterol is a waxy, fat-like substance that your body needs to build cells and make certain hormones. However, too much of the wrong kind can create problems because it is carried through our bloodstream by lipoproteins. Now, there are 3 forms of cholesterol. One is low density lipoprotein, LDL. Another one is high density lipoprotein, HDL. And the other one is triglycerides. Now, what is LDL? LDL is the one we call bad cholesterol. It's the bad one. Now, it can build up in the walls of your arteries, forming plaque and narrows and hardens them, what we call atherosclerosis. So, low density lipoprotein is the bad one, or what we call the LDL. But the good one is the HDL, which is the high density lipoprotein. Now, this is what we call the good cholesterol. It acts like a scavenger. Then it carries LDL cholesterol away from the arteries and back to the liver to be processed and removed from the body. So now, the third one is the triglycerides, and this is the most common type of fat in the body. High levels combined with high LDL or low HDL can increase the risk of cardiovascular disease. So, to recap, you have the high density lipoprotein, which is the HDL, then you have the LDL, which is the bad one, then you have triglycerides, which is also the bad one.
Now, how exactly are women affected by this high cholesterol, since we know that the bad one is the low density lipoproteins? How does it affect women, and what gender is more at risk? Are the men more susceptible to this low density lipoprotein, the LDL, or are women more susceptible, and how does it manifest in both genders?
Oh, thank you very much. Thank you very much. High cholesterol, particularly the LDL, is a major risk factor for heart disease for everybody, whether man or woman. A woman that is within the reproductive age group, from around that 13 to 50, they are being protected. Now, a woman is protected before menopause because of the hormone called estrogen. So estrogen helps to protect the woman. What does estrogen do? Estrogen helps to raise the HDL, which is the good one, and help to lower the LDL, which is the bad one. But however, during menopause, when a woman gets above 50, that's why you see that most heart diseases are commoner in men than women around that age. But during menopause, estrogens drop significantly, and this leads to a dramatic shift in a woman's cholesterol profile. Now, LDL is the good one. So, the estrogen protects against it. But as the hormone profile, as the woman gets to menopause after 50 years, then the LDL begins to rise because there's no more estrogen again to protect against it. Right. Then you also have some pregnancy factors that also contribute to it. Cholesterol levels naturally rise during pregnancy to support the baby development. However, this way it turns back to normal afterwards. Then there is what called the gestational diabetes and hypertension or preeclampsia. Now, having this condition in pregnancy, such as gestational hypertension or preeclampsia during pregnancy, is a red flag, and this indicates a higher long-term risk for developing high cholesterol, high blood pressure, and heart disease later in life. And like the Director General of the WHO said, hypertension is a major killer, particularly around the world, but majorly in low and middle income countries. The other female specific factors include women that have PCOS, like I said that day, people that have polycystic ovarian syndrome. Women PCOS are more likely to have insulin resistance. And when they have insulin resistance, this is linked to higher triglycerides and lower the HDL cholesterol. So PCOS increase the triglyceride, which is bad, and lower the HDL, which is good. So that will also lead to it. Then of course, people that have some autoimmune diseases, like people that have lupus, that have rheumatoid arthritis, these are more common in women and are linked to higher risk of heart diseases. Then finally, people that use birth control pills, some other form of OCPs can raise cholesterol levels, but newer formulations are better. Then finally, so women that are on hormone replacement therapy can also affect cholesterol levels and also lead to heart diseases. Thank you.
Are there specific causes, aside from pregnancy and cholesterol being made available to cater to the baby growing in the womb, are there specific causes, reasons why cholesterol, the bad cholesterol, would now be in large quantity in these women?
Because of the climate change, because of things we do in our environment, we eat a lot of food that are not good, because we should take food as medicine. So for women, things that can increase cholesterol levels are food that are not good. For example, there's some people that eat sugary foods, refined sugars, and people that take a lot of saturated fats. Saturated fats tend to raise your LDL cholesterol. So people that take saturated fats, the people that take a lot of refined carbohydrates and sugars, this can lead to weight gain and increased triglycerides. Then again, people that don't do exercise. Exercise is a potent tool. So people that, a lot of our women these days don't do exercise. They become overweight and they become obese. So these are things that can lead to raised HDL, which is the raised HDL, and of course, raised LDL, which is the bad one, and lower HDL, which is the good one. So exercise is very good. Therefore, refined sugars and carbohydrates, those are the things that lead to such increase.
High cholesterol, in this case, what circumstances do they create for women who are trying to have children? Does this affect their ability to conceive, and does this have any influence on what their pregnancy journey is going to look like?
Very good. Thank you very much. Like I said earlier in the other presentation of polycystic ovarian syndrome, we know that in polycystic ovarian syndrome, women have insulin resistance. And because they have insulin resistance, they have higher triglycerides. And PCOS, we know that in PCOS, there's anovulation. Now, what the woman will have anovulation or oligo-ovulation. Oligo-ovulation means reduced ovulation. Now, what is ovulation? Ovulation means release of egg. Every month, a woman is supposed to release egg. And when that egg is released, then the sperm that is coming from the vaginal cervix endometrium meets the egg at the fallopian tube. And when they meet, they fuse together in a process called fertilization. And when there's fertilization, then there will now be formation of a baby which now begin to implant on the endometrium on the 5th day. But however, for women that have PCOS, which also lead to people that have high cholesterol, there's decreased ovulation. So the woman will not be able to release egg. And if they don't release of egg, the sperm will come, you will not see any egg to fertilize or to meet with, and that will reduce the fertilization process, and that will eventually ultimately lead to a reduction in fertility. Thank you.
All right then. So let's talk about signs and symptoms. How can you tell that there is a presence of high cholesterol in a woman?
High cholesterol has no symptom. High cholesterol has no symptoms. So you can feel perfectly healthy and still have dangerously high levels. So a lot of people walk around the streets of Nigeria and around the world with very high cholesterol with no symptom. They feel healthy, they feel okay, so they don't even feel the need to go to the hospital. The only way a man or a woman can know that they have high cholesterol is through a blood test called a lipid panel or a lipid profile. Later we'll come to the various levels, the levels of the LDL, and I will give you the levels. So there are no symptoms. So once a woman or a man has high cholesterol, you keep walking around the streets not knowing that anything has happened. The right time you can only know is when you come for a test. Then of course, when you notice that you're also getting overweight, I mean, you know, your weight, you discover that you are weighing more than you were weighing before. It is hugely important to go to the hospital and do a lipid profile or a lipid panel, because it's through those lipid profile that you can know that you have it. So that's why in most countries of the world, the all adults aged 20 and above should have their cholesterol checked particularly every 4 years, if possible. Then of course, women are over 40 and those with any kind of risk factor. Women above 40 and women with any risk factor like diabetes, high blood pressure, or there's a family history of cholesterol in your family, do a lot of cholesterol checks more frequently, and you may have to take cholesterol lowering agents that will be prescribed to you by your doctor. So to recap, it is very important to note that high cholesterol has no symptom. So you can be very well, you can be living healthily, but you have dangerously high levels of cholesterol. So the only way you can know is to approach your healthcare provider and do a lipid panel or a lipid profile. Then after that, then of course, it is important to be doing it regularly. But if you have diabetes, what I call risk factor, diabetes, hypertension, or you have family history, or you have history of polycystic ovarian syndrome, PCOS, it is important that you do the lipid panel more regularly, and you see your healthcare provider more regularly for evaluation and management. Thank you.
Unfortunately, when people gain weight, they don't think about high cholesterol. They just dismiss it as maybe poor feeding habit, and that constitutes a problem. Let's talk about complications. We'll talk about the treatment and management, and as you said, the different steps that it takes for diagnosis. But let's talk about complications. If left unchecked, unfortunately, you might go on for years and not.
But it is preventable and treatable, which is why we must commend your attention again for enlightening the public. So one thing that high cholesterol can cause is hypertension. And without urgent action, without intervention, it can lead to premature deaths, and countries will face high mounting economic losses. So high cholesterol leads to hypertension, it can lead to deaths, then it can lead to stroke, can lead to heart attacks. So not bringing it under control is very deadly, because it can lead to serious complications like hypertension, heart attack, stroke, and other things. Thank you very much.
Let's double back to the fertility and pregnancy issue. A woman who has high cholesterol who is pregnant, I would assume that that is a high-risk pregnancy, right?
Yes.
Does that have any effect on the fetus, or it's just the woman that is affected by this high cholesterol?
Oh, thank you very much. Now, a woman that have high level of cholesterol, like we said, it can cause input out diabetes and put out preeclampsia. Now, what is preeclampsia? Preeclampsia is pregnancy-induced hypertension plus proteinuria. Now, what is pregnancy-induced hypertension? Any woman that has high blood pressure more than 140 millimeter of mercury over 90 after 20 weeks of pregnancy has PIH or pregnancy-induced hypertension. And if a woman that has pregnancy-induced hypertension has proteinuria, that was protein in the urine, she has preeclampsia. And any woman that has preeclampsia that shakes or that has convulsion, that is called eclampsia. Now, like we earlier asked, what is the effect? Now, affecting the woman can die from eclampsia. She can die from severe preeclampsia. Then, apart from that, the baby inside the womb can come out prematurely, because preeclampsia, pregnancy-induced hypertension, and eclampsia are major causes of prematurity. Even in the UK, it's the highest cause in the UK. So now, the baby will come out. Normally, a baby should come out from 37 weeks to 42 weeks. So when a baby come out below 37 weeks, that baby is premature. And sometimes some baby can even come out around 30 weeks. By that time, their lungs are not well formed. And if the lungs are not well formed, the baby will now stay in the incubator for long. And the husband and the wife that deliver the baby will have to pay money for incubator care, for pediatrician care. So to recap, now it can cause, it can be associated with hypertension, preeclampsia, which can lead to the death of the woman herself if not properly managed. it can lead to the death of the baby, it can lead to premature delivery of the baby at an age when the baby can barely survive. And that will lead to more cost, economic cost for the husband and the wife, in this environment. So high cholesterol should be properly identified on time, whether during pregnancy or before pregnancy. In fact, it is very important that we ensure that every woman going into pregnancy should have what we call a preconception care. Now, what is a preconception care? Let me define and I will explain this quickly. Preconception care is a specialized form of care offered to women of reproductive age before the onset of pregnancy to detect, treat, or counsel them about pre-existing medical and social conditions that may militate against safe motherhood and the delivery of a healthy offspring. Let me come again and I will explain it. Preconception care is simply a specialized form of care offered to women of reproductive age group before the onset of pregnancy to detect, treat, or counsel them about pre-existing medical and social conditions that may militate against safe motherhood and the delivery of a healthy offspring. That means that before a woman goes into the voyage of pregnancy and childbirth, that woman should have her cholesterol level checked, her blood pressure will be checked, then to check her weight before pregnancy begins. Because once you enter into pregnancy, there's some drugs you cannot give the pregnancy because of safety issues. So before you get pregnant at all, her cholesterol level must be optimized, her blood pressure must be optimized. If you have diabetes, it must be controlled. If you have anemia, that means low blood level, it should be optimized before she embarks on the voyage of pregnancy and childbirth. Thank you.
All right, thank you very much, Dr. David. Now let's talk about the diagnosis. I know you said you're going to give us everything that the lipid panel involves. So talk to us. How do we go through that process of a blood test? At the hospital, what does it entail? The lipid panel, what do you check for when you do that test?
Oh, thank you very much for another very insightful question and apt. Now, if a woman, come to the hospital, most men, like I said earlier, the women that have high cholesterol levels will not present with any form of symptom. So she could even have very high level, but she will not have any symptom. No headache, no body pains, no eye pain, nothing, no dizziness. So, which is why it's important to check our cholesterol level regularly. So when you come to the clinic for evaluation, first, we'll take a very good history. Like in all cases of patients come to the hospital. When a patient comes to the hospital, the first thing we do is to take a comprehensive health history. Finding out how old the woman is, her last menstrual period, knowing whether there's any history of high cholesterol in women, because they what we call familial hypercholesterolemia. Familial hypercholesterolemia. That familial hypercholesterolemia occurs in families. So you ask questions about the woman, do your mother, or do you have any history of high cholesterol in your family? So she will not tell you, my mother has high level, my auntie has this, or my brother has this, my father has this. So we ask that question. Then after that, then you take on other history, menstrual history and the rest. Then we now do a thorough physical examination. You will notice that the woman may be overweight. No, she may be overweight. Then even also take a dietary history, asking her what food does she eat. Because most women eat a lot of refined carbohydrates. And when these carbohydrates are not very good for women, you also ask her whether she has a history of polycystic ovarian syndrome, PCOS. Women that have polycystic ovarian syndrome are also more predisposed to having high cholesterol and high triglycerides. So this is also very important. Then after that, start taking a very good history and you have done a thorough physical examination. Number one is a comprehensive health history. Number two is a thorough physical examination. Then number three is now to do a lipid panel or a lipid profile. Now in lipid panel and lipid profile, what does it entail? Now in lipid panel, I told you just now that there are three major things. The high density lipoprotein, which is the HDL. You have the low density lipoprotein, which is the bad one, which is the LDL. Then we have the triglyceride, which is also a bad one. Then we have the total cholesterol itself. Now your blood is collected and it is, they check the level of the HDL, the level of the LDL, the level of triglycerides, and the level of total cholesterol. Now what are the levels? Now if you do your high density lipoprotein, and it's about, it's supposed to be, normal to be around 50 to 60. It must be less than 50 to 60 milligram per DL. It must be less than 50 to 60 milligram per DL. Then if you do your low density lipoprotein, which is the LDL, it should be less than 100 milligram per DL. Then if you do your triglycerides, it should be less than 150 milligram per DL. And your total cholesterol should be less than 200 milligram per DL. Let me come again. If you do your HDL. The HDL should be less than 50 to 60 milligram per DL. Then your low density lipoprotein LDL should be less than 100 milligram per DL. Then your triglycerides should be less than 150 milligram per DL. Then your total cholesterol should be less than 200 milligram per DL. So these are the values: HDL 50 to 60 milligram per DL, LDL less than 100 milligram per DL, then triglycerides less than 150 milligram per DL, and total cholesterol less than 200 milligram per DL. So those are the values. Thank you very much.
All right, thank you. So, first of all, does high cholesterol have a cure, a specific cure that once you get treated or once you get administered that cure, you wouldn't suffer high cholesterol? Or this is a condition that you have to consistently manage, maybe with your diet or hormone maintenance, or you tell us all the complexities of that. But can it be cured, first of all, or this is a condition that you have to manage over the rest of your life?
Oh, thank you very much. You have done a lot of work on this topic. You've done a lot of research. Thank you for your question. Now, managing, like you said, it cannot be cured. You manage it. So it cannot be cured. You manage the cholesterol levels. And we do what I'm going to say now. Now, management and treatment of cholesterol is hugely important. And it has a two-pronged approach. We approach the management of high cholesterol through a two-pronged approach. Lifestyle changes and medications are the two-pronged approach we use in the management of high cholesterol. Now, when talking about lifestyle changes, what do we mean? Now, lifestyle changes is the foundation of treatment. Now, one is diet. We call it the food as medicine approach. The food as medicine approach. What does that mean? Number one means that you will reduce your saturated and trans fats. You reduce saturated fat in your body. And these saturated fats are found in red meat, full fat dairy, fried foods, and processed baked foods. So you reduce red meat in your diet. For instance, I hardly eat red meat at home because I ensure that I want to reduce saturated fatty acids. Then you increase soluble fiber. Like this will help to block absorption of cholesterol. Like oats, barley, beans, apples, citrus foods. So increase soluble fiber, which help to block absorption of cholesterol. And this include oats, barley, beans, apples, and citrus fruits. Then you eat what you call heart-healthy diet. Heart-healthy fats. These are very, very important. This one you focus on saturated fats like those in avocados, nuts, seeds, and olive oil. So this is very, very important. Then of course you limit sugar, refined carbohydrates. Limiting it is very, very important. Then of course there is diet. So we're talking about lifestyle modification now. You reduce saturated fats, you increase soluble fiber, you eat heart-healthy diets, then you limit sugar and refined carbohydrates. Then for the diet. Then for physical activity, you must aim at least a minimum of 150 minutes of moderate to intensity exercise per day. You can be brisk walking, you can be swimming, you can be cycling per week. I run virtually every day. I do brisk walking. This will help to ensure that you are back in physical activity. Because exercise will also help. What exercise does is that exercise helps to raise the HDL, which is the good one, and lower cholesterol and lower the LDL, which is the bad one. So exercise will help you to lower the LDL, triglyceride, and cholesterol, and help to increase the HDL, which is the good one. Smoking. The smoking also damages blood vessel and lower HDL cholesterol. So quitting smoking can improve your HDL level. Then of course, you limit alcohol. Excessive alcohol intake can help to raise triglycerides levels and blood pressure. So these are things you do. Then finally, the medications. Now, if sometimes you may do lifestyle changes and it can work. And other times you may need to add medication like statins to it. So you want to discuss with your medical professional who now help you to tailor the statins and other medications that will suit you as an individual, because you have to be personalized and individualized. Thank you.
Thank you very much, Dr. David. Well, this is very, very important for the conversation today. We spoke about high cholesterol in women, and Dr. David was gracious enough to actually expand the conversation to even the men. You can be affected as well, but because this is the specialized health program for women and children, we chose to place the focus on women, especially how badly it can affect them when they're pregnant or when they experience all these hormonal adjustments in their system. They can't help it, and also how they suffer from this condition when they attain menopause, seeing as there's no estrogen, right, to support them or protect them from high cholesterol. Dr. David, before we leave, let's get your final word on this conversation, since you've emphasized that diet, lifestyle changes, sometimes medication, but most importantly, using our food as medicine. I'd like for you to reiterate that point and give us your final word as we end the conversation for this morning.
Yeah, thank you very much. Thank you very much for that beautiful question again. Yes. Now, like I said, my final word would be that high cholesterol has no symptom. And that put a heavy burden on individuals, all of us, to be very careful to go to any medical, our healthcare workers, our healthcare professionals, to check our lipid panel every time, because high cholesterol is not good for both men and women, and it can lead to hypertension, which is a leading cause of heart attack, stroke, chronic kidney disease, and dementia. And I know that, like the WHO said, the recent report, that 1.4 billion people live with hypertension in 2024, and only 1 in 5 had under control. So that means that this thing is with us. We must not joke with it, we must not toy with it. We must all gather together to join hands together to eradicate high cholesterol in our land, and thereby reduce the prevalence of hypertension in our land. Thank you very much.